Diabetes is becoming an epidemic. Almost 18 million Americans have diabetes, and 1/3 of this group are not aware they have it. If gone undetected and not treated, they're going to develop serious complications, according to Dr. Paul Guleria of Desert Regional Medical Center in Palm Springs.
There are two main kinds of diabetes, type 1 and type 2, and 90 to 95% of diabetes which we see today is type 2 diabetes. And that's the diabetes which is directly related to sedentary lifestyle and weight gain. And the main difference between type 1 and type 2 is in type 1 diabetes, you don't make any insulin at all. So the treatment for type 1 diabetes is nothing else but insulin. Type 2 diabetes is when your body is making insulin, but your tissues are ignoring that insulin. Your body tissues are actually resistant to your insulin. So insulin is not able to do its job. To overcome this resistance, your body starts making more insulin. So actually there are some patients in the early stage of type 2 diabetes which make more insulin than a normal person, but you still have abnormal metabolism. So these patients eventually will also lose the capacity to secrete enough amount of insulin, and that's when they become diabetic. When you develop diabetes, most patients will not have any symptoms, and but some patients will have symptoms in the form of feeling more thirsty, going to bathroom more frequently than usual. They may have blurring of vision. Very rarely you can even have tingling and numbness in your feet in the beginning of diabetes. But the reason I want to emphasize no symptoms is that just because you are not feeling abnormal does not mean that you should not be checked out for diabetes. If you have a strong family history of diabetes, if you are one of those ethnic groups like American Indians, Hispanics, or African Americans, and especially if you have gained a considerable amount of weight in the last few months, you need to be checked for diabetes. In the beginning, the treatment for diabetes is lifestyle modification, which means that you should be able to exercise. You are asked to exercise regularly. If you exercise for half an hour 5 times a week, that reduces your blood sugar considerably. Also, if you follow a diabetic diet, so those patients are usually asked to avoid foods which are very sweet. They are advised to avoid cookies, candies, ice creams, or at least cut down intake of those foods, and also decrease in general your intake of carbohydrates. So exercise and diabetes is usually the first line, but unfortunately most people, they don't follow those recommendations and they usually end up on medications. Now, if you have diabetes, then you can actually go blind. You can end up on dialysis, or you can develop an ulcer which may never heal, and you may need amputation or because of gangrene. But these complications, microvascular complications, are usually not the cause of death in these patients. The reason these people die is because they have macrovascular complications, which means they die from heart attacks and strokes. And people who have diabetes, they are at risk for having a heart attack and stroke up to 4 to 5 times more than a person who does not have diabetes. So there are so many reasons we need to keep these blood sugars in control, not only for a good life, but also for survival.